Hey, what's going on, guys? It's Dr. Leslie, physical therapist, and today we're going over a condition called spondylolisthesis. What a tongue twist, right? But we made sure we spelled it out for you. So, this condition is very common, especially in the younger population. So, essentially, what this is just slippage of your vertebrae on top of one another. So, if my fist here is a vertebrae, and this fist is a vertebrae. Your vertebrae stack on top of each other, which you have a disc in between them to lubricate those joints. When spondylolisthesis happens, the top vertebrae, my top fist, slips on the bottom one, right? So it just essentially just slippage of vertebrae on top of each other. A lot of times, people may not have pain with it, but this usually happens when you have repeated lifting and doing it incorrectly, right? So repeated microtrauma. A lot of times the cause is unknown, but a lot of times when you do repetitive lifting and repetitive like extension stuff with your back incorrectly, this can lead to that anterior slippage or that slippage of that vertebrae. So you want to be careful with that. Usually it is with younger individuals, active individuals. The presentation of how it comes about is that midline lower back pain across your back. So if you have been diagnosed by it, whether through imaging to have spondylolisthesis, this is something we're going to show you some actionable stuff you can do, but you still want to seek a physical therapist to get the perfect plan of care just individualized for you, right? And if you have been doing a lot of lifting over years or have a job that does a lot of lifting, you're not sure if you're doing it correctly, and you do have some discomfort in your low back right across the midline, this could be also actionable stuff for you, but you do want to seek a physical therapist to determine the right plan of care for you. Okay, so the first thing we're going to do to treat spondylolisthesis is an exercise called double knee to chest. So what this does, this opens up the spine, and then it allows that vertebrae on the top to get back into its ideal position, right? So it's not slipping forward anymore. We can kind of push it back. So this brings that spine in that position. So we're going to bring our knees up, support behind your knees, pull your knees to your chest as far as you can, and we're going to hold this for 30 seconds. Should feel also a nice stretch in the low back. Should feel good. After 30 seconds, bring it down nice and gentle. We're going to do that for 3 sets, okay? Hold 30 seconds. All right, so the next one we're going to do is an exercise called seated lumbar flexion, or we could say seated lumbar bending. What this does is the same concept. It brings that vertebrae back into an alignment, right? So remember that forward slippage, so it's bringing it back into that alignment. So bending over exercises where we have our spine work on flexion rather than extension is what helps spondylolisthesis, right? So let's get into this one. We're going to sit up nice and erect, and what we're going to do, you can have pillow support behind you if you like, and what you're going to do, you're going to have your hands, you're going to bend at the waist, then at the spine. You're going to have your hands touch the floor. You're going to hold that for 10 seconds, 10-second count. And then you're going to come back up to the middle. Okay, what this does is puts that spine into that vertebrae back into in its alignment. You're going to perform this 10 times. Every time you want to hold it for 10 seconds. Right? So this is great. You could do this at work if you have a sitting down job, or if you're taking a break. wherever at home or work, right? So this is called seated lumbar flexion or seated lumbar bending. Now we're transitioning to an exercise called core stabilization. So with spondylolisthesis, since it's more of a movement in coordination, right? There's a lot of incoordination going on in the spine, the vertebrae, right? Because we talked about that slippage. So now that we kind of worked on movement positions and movement-based exercises, we have to work on stability. We have to work on the muscles that actually attach on the spine. Therefore, you don't have that discomfort and that vertebrae is not really moving as much. With repetition and time working on these things, we can get that vertebrae to get back into its alignment. And part of that is working on core stabilization. So I'm going to show you how to do that. We're going to lie down, get in that hook lying position, right? So the first step to core stabilization is finding your belly button. Once you find your belly button, you're going to go to the side. You're going to wrap your thumb on your low back. Okay? So what you're going to do here, you're going to pretend that you want to put on a pair of pants that's too tight for you. The reason I say that is so you can have those core muscles engage that attach directly on your spine, right? So essentially your belly button is going straight down into the couch or bed or mat, yoga mat that you have without holding your breath, right? So if you have to hold your breath, then you're doing it incorrectly. So I'm going to perform one to show you guys how to do it correctly, okay? And then as I do it, I'm going to say 1, 2, 3, just to make sure I'm not holding my breath and I keep that hold. All right, here it goes. I'm going to bring my belly button down straight, down into the couch, all right? And here we go. 1, 2, 3, and then I relax, right? Now, if I were to hold my breath while trying to bring my belly button down, this is how I wouldn't be able to count down, right? So it's impossible to talk. I just held my breath, right? So if you feel like you have to hold your breath while bringing down your belly button, right? Pretend like you put it on a pair of pants that's too tight for you, then you're doing it incorrectly. So when we do that, we're going to do this 10 times, and you're going to hold 3 seconds, counting out 1, 2, 3 for every repetition. So I'm going to perform 3 straight. 1, 2, 3, and then I can relax it again. 1, 2, 3, and then I can relax it, and again. 1, 2, 3, and then I can relax it. All right, we're gonna do that 10 times, and you want to perform that for 3 sets. This is very key in getting that vertebrae back into its position and keeping it there. All right, guys. So that is core stabilization. All right, guys, so we're going to finish out to show you some stretches to make sure that we could get that forward slippage back to in its alignment and staying there. So a lot of times we also have tight muscles that can contribute to the anterior slippage. And one of those muscles are your hip flexors, right? Muscles that attach to the front of your hip, pulling your pelvis forward, making that forward slippage kind of a little bit more worse, causing your low back spine to be in extension. So a good one to do, you're gonna get a pillow, you're gonna find a chair or wall, you're gonna put your foot on the chair or wall with your knee bent, your knee is gonna go on this pillow here, and what you're gonna do, you're going to keep your torso straight, and then you're gonna Lean forward while keeping your torso straight. You're getting a nice pull in the front of your hip flexors to help release that pelvis and therefore take off pressure off the spine to straighten up, right? And help that forward slippage. Right, you're gonna do this for 30 seconds, 3 times. You wanna do both sides, okay? So for the purpose of this video, we're just gonna show you one side, but you wanna do both sides. Alright guys, hope you enjoyed this video, and that is how you treat spondylolisthesis. Once again, you wanna be able to see a physical therapist if you have been diagnosed or you feel like you have done repetitive lifting and have that presentation of spondylolisthesis, but you do want to seek a physical therapist for your ideal plan of care.